My name is Iyamide Thomas, and I'm the Regional Care Advisor for the Sickle Cell Society. The Sickle Cell Society was formed in 1979. It was formed by a whole load of health professionals, people with sickle cell, individuals with sickle cell, their families, and their carers of people with sickle cell who were concerned about the lack of awareness of this condition and the treatment they got in hospital. The Sickle Cell Society's mission is to enable and assist individuals affected by sickle cell to achieve their full economic and social potential. Now, we do that in a variety of ways. Awareness raising is one of the ways. We also help with welfare support and education. And people usually come to us if they're having problems with welfare. The society has two main funds that that make accessible to individuals affected by sickle cell. We have our welfare fund, which is a fund that people can apply to. It's to provide household goods like washing machines, carpeting, cookers, that sort of thing, to enable them to live a better quality of life. We also have an educational fund, and that's to provide things like extra tuition for children who've missed out on school because of their illness and being in hospital, so they can access that fund and get extra tutoring for a couple of weeks. So we also could provide some money towards books, school books, if they need, maybe a computer. So we provide that. We also have a children's holiday, and that's an annual children's holiday, and that's quite good because it offers respite to the parents, who have children with sickle cell, and the children go away to a nice camp for a week and come back quite refreshed, I think. One of the most contentious issues to do with sickle cell is pain and the management of pain, because what you have is in various areas, the people who are affected by pain, they don't get given the right pain medication, or their pain threshold isn't believed and things like that. So the management of pain is one of the key issues, because when people are in crisis, they're in immense pain. And that's what we get a whole lot of complaints about the particular medication they're on, and the fact that sometimes the doctors believe they're addicted to this medication. So the society does a lot of work with health professionals around that. We get a lot of complaints and questions and requests for help with advocacy, and these are around issues to do with employment, housing, schooling. Again, it's due to the lack of awareness of the service providers. So what we tend to do is we need to go in and give talks to housing professionals who are not aware of the risks people face if they're in a cold house, or if the place is damp, things like that, or if they have to climb a lot of stairs. So we do a lot of that around the social, issues around sickle cell. The society was quite key in lobbying for the screening program, to have a national screening program for sickle cell, so that people would be aware they were carrying the gene and make informed choices. So the Sickle Cell Society was pretty good at doing the lobbying, and it actually resulted in the NHS screening program being formed, which is something we're quite proud of. One of the hopes, again, for a lot of people is free prescriptions. They actually, we've been lobbying for that, and we're still lobbying for that, because people spend a lot of money, on their medication, and there's the free prescription lobby as well, so we'll be continuing with that. People, I think, still feel stigmatized about the condition, and I really think we have to get away from that, especially in the Black community where it's most prevalent. We need to think about it. We need to come out if our families are affected by it, so that we can raise awareness, because we need to start raising awareness amongst the Black communities anyway, and that's how you'd get the awareness raised, amongst the indigenous population in this country. I mean, if at least it's, we all help raise awareness of sickle cell, we need to do that. It's not a curse, it's nothing to be ashamed of. It's a genetic condition like other genetic conditions, and I think really we need to talk much more about it within the Black community. Recently, the society has been involved with launching some standards, for the clinical management of sickle cell in the UK amongst adults. 2 years ago, the pediatric standards were launched. Now it's the adult standards, and we're hoping that that would really take away the inequality of care around the country. I mean, these standards, if adopted, would provide a basic minimum level of care for somebody with sickle cell, no matter where they access it around the country. So that's one key thing that we've been involved with over the summer. Another thing that we'll be doing is embark on a project that's going to concentrate on giving people advice about the welfare support they can have. We've been funded for that, to specifically give people advice about the welfare support they can have and how they can change that to either individual budgets or direct payments that will give them more flexibility in the way they access the support. So those are two key things that we'll be doing over the next few months as well, promoting the standards and doing the welfare support.